Hi, I'm Lori Reed. I'm a nurse practitioner in advanced lung disease in Atlanta, Georgia at Piedmont Healthcare. We're here today for a journal club presented with the support of APAP. This journal article is titled Practical Considerations for Managing Patients on Tyvaso DPI, treprostinil inhaled powder. This was published by Jennifer Keeley and colleagues and published in the journal Pulmonary Circulation on July 3rd, 2025. In this article, it is an expert consensus gathering of recommendations based on the literature, our clinical experience, and patients' perspective for the considerations for use of treprostinil dry powder inhaler. So a little background, pulmonary arterial hypertension and pulmonary hypertension related to interstitial lung disease are progressive life-threatening conditions requiring multifaceted, specialized management. Prostacyclin analogs like treprostinil have been shown to improve hemodynamics, exercise tolerance, and survival, but their systemic formulation, when it's taken parentally or orally, cause a number of adverse effects that the patients then have to deal with. So inhaled treprostinil minimizes some of those systemic adverse effects, still targeting the prostacyclin analog there, but hopefully making it a little easier for patients to tolerate in the adverse effect side of things. So Tyvaso DPI was approved in the U.S. based on the BREEZE study in 2022, offering more convenience over the nebulized version of the Tyvaso. And so this review updates kind of practical guidance and guidelines for clinicians focusing on the Tyvaso DPI option and some recommendations from the World Symposium also. So objectives of the article provided an overview of the treprostinil therapies and then the practical recommendations from pulmonary hypertension advanced practice provider experts, where they gathered patient information, education that they would have provided, how they communicated with patients about their disease state and about medication, onboarding and starting this therapy, transitioning this therapy from other therapies, and how to mitigate some of those adverse side effects that patients can experience. They also looked at some resources from other clinicians and patients, and then were able to put together something that can be incorporated into real world kind of PH-ILD clinics too. So the design was consensus-based review. It wasn't a systemic review or trial. They convened 5 expert APPs who had a median age of about 15 years of PH experience. And this was sponsored by United Therapeutics. There were 2 virtual interviews with everyone with some Q&A sessions to discuss what literature was found and what the literature supports and sharing best practices across the different centers where these APPs worked. They drew information from a couple different clinical trials, the BREEZE trial, INCREASE, and TRIUMPH, those helping guide the World Symposium guidelines also. A couple limitations in this article. There is potential for some bias based on specific centers or sponsorship involvement. It was not a Delphi consensus, and it could be limited based on the geography of where the expert APP centers were across the U.S. So there were some key findings and results within this article that are important that we touch on. The device characteristics with this Tyvaso dry powder inhaler. This inhaler is a low flow, high resistance inhaler requiring just a little bit of inspiratory pressure to get the medication delivered into the lungs. This device makes it easier for patients to go about their lives, to get out of their home because it's small and transportable, a lot less logistics and burden than moving the Tyvaso nebulizer with them throughout the day. And then even patients with reduced lung function, so our ILD patients, are able to pull in enough breath to have the medication delivered as it should. So it makes it suitable for a diverse group of patients, not just your pulmonary arterial hypertension patients, but those patients with PH-ILD. Patient selection. So pulmonary arterial hypertension patients get improved hemodynamics, improved function, improved quality of life with use of treprostinil. And use of the treprostinil DPI has the potential to continue to improve some of those things. But what has been shown is that the Tyvaso DPI does improve patients' ability to do more. They were able to walk farther with less shortness of breath and less symptom burden, which is what the medication was actually approved to do and what actually impacts patients' lives, helping their day progress and help them do what they want to do throughout the day a little easier. So education and onboarding, this article reviewed what they recommend and what they found successful as an initial visit with these patients when you're talking about starting this therapy is needing a visit that's 45 minutes or longer so that you have enough time to incorporate all the information and all the team members in that visit to make sure that the patient's educated and understanding what the medication does, what their diagnosis is, what they expect to gain from it. They discussed making sure that the patient understands what their diagnostic tests showed and what they mean for them in their disease state, what their treatment options are, and what the goals are. They talked about making sure that this is including the patients in the conversations so that the patients are stating their goals also. They also recommend making sure that time is spent on talking about the expected adverse effects and symptoms with use of the Tyvaso DPI. They put in some good flow charts and supplemental material that goes over the side effects and mitigation strategies, but making sure that that's part of what's discussed when this is being onboarded for the patient. Common side effects they acknowledge were seen was cough, headache, nausea, and diarrhea. These are not different than treprostinil in general. But when we talk about using this dry powder inhaler, that's where it kind of differentiates, and specifically cough and sore throat. So they talk about reviewing mitigation strategies for those specifically in the Tyvaso DPI patients. Some of those recommendations can include proper technique with the device, drinking cold or warm liquids prior to or after use for the cough, headache strategies, using some analgesics or slowing the titration of this medication. And then for the nausea and diarrhea, using some of the pharmacologic therapies that we typically use for that. And then they also acknowledge that these patients aren't often dealing with just PAH or just PH-ILD, but there's other comorbidities that patients may be dealing with. So making sure we're not forgetting about acid reflux contributing to symptoms or seasonal allergies or anything like that, and making sure we're addressing them too. Titration strategies and monitoring, they spoke to starting low and slow, titrating every 1 to 2 weeks to a max tolerated dose. That was reviewed with the BREEZE study. And then talking about the equivalent doses between the Tyvaso DPI and the Tyvaso nebulizer and understanding what those are and understanding that patients can transition from one device to the other relatively easily because of those equivalent dosing. And then making sure that the patient understands the titration schedule so that they don't go too quickly and they know when to call if they have adverse effects or other symptoms. And then making sure that they know what to monitor while they're titrating and using the medication. So these authors talked about the pulse oximetry and monitoring the patient's oxygen levels while they're at home. They did incorporate and touch on making sure that it's kind of a multidisciplinary discussion in the office if it's available, but also making sure you're incorporating specialty pharmacy because with the Tyvaso DPI, specialty pharmacy comes out and educates patients on how to properly use the device, how to titrate it, what side effects to expect, and also the strategies to mitigate it. And they're also a great resource to help notify providers if strategies aren't working and the patients aren't calling us too. And then getting patients in support groups. They touched on that also. So kind of in conclusion, the Tyvaso DPI, they found to be convenient, portable. It also enabled patients to get to higher doses at times than they were able to get with the nebulizer. To make sure that there's a key focus for success on making it a patient-centered care approach, early intervention, not delaying access to this therapy, and then collaboration across the team with specialty pharmacy, with centers access, medication access persons, centers RNs, centers providers. And then also touching on future needs, acknowledging that we may need some more information on data on higher doses and on earlier diagnosis use. We know that the studies that approved the Tyvaso DPI were completed when the diagnosis of pulmonary arterial hypertension was made with higher parameters in mind than what we have as the guideline parameters now. So it may be worthwhile to go back and look at what these lower parameters mean for patients on this medication. So thank you very much for joining. I appreciate being here.